Okay, welcome everybody. We're going to go ahead and get started. Um, Hello, thanks for joining. My name is Ben Negron. I want to welcome all of you to the webinar series for the Autism Intervention Research Network on Physical Health, the AARP, as you know. Really appreciate you joining us today. Because of the number of participants, your audio will be muted throughout the call. However, you can submit questions at any point during the presentation via the Q&A feature, or you can just type them in the chat box as well. This entire webinar is being recorded and it will be available on the AARP website at the link I just put in the chat. And there will also be a short evaluation survey at the close of the webinar that I'll put in the chat as well. We invite you to provide feedback on the webinar and provide suggestions for future webinars as well. So in the interest of time, get started. I just want to first acknowledge the Health Resources and Services Administration as a funding source for AARP. This project is supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services under the Autism Intervention Research Network on Physical Health grant. The information, content, and/or conclusions are those of the authors and should not be construed as the official position or policy of, nor should any endorsements be inferred by HRSA, HHS, or the U.S. government. Then I'm going to pass it off to Dr. Emily Hotez. She is going to introduce our speakers for today.
Hi, everyone. It is wonderful to be with you today. My name is Emily Hotez, and I am a project scientist on the Autism Intervention Research Network on Physical Health. Today, we are thrilled to speak with you about leveraging the AIRP for collaborative research through the LEND program. And I'll introduce my fellow panelists in a bit, but we'll hear from Sandra Friedman, Jessica, and Tony Whittaker. Next slide, please. The Autism Intervention Research Network on Physical Health is a large HRSA-funded network that is meant to spur more research on the physical health and well-being of autistic individuals across the life course. It is interdisciplinary, and it is a multi-center research network with far-reaching research nodes covering high-priority areas in autism research. The goal of the AIRP is to lead, promote, and coordinate national research activities to improve the physical health and well-being of autistic individuals across the life course. Next slide. Today, we are talking about the intersection between AIRP and LEND. For those of you who are unfamiliar, LEND stands for Leadership Education in Neurodevelopmental and Related Disabilities. It is a collaborative and interdisciplinary set of training programs with a focus on understanding the impact of neurodevelopmental disabilities on individuals and families. And LEND programs are dedicated to training interdisciplinary health professionals who are working to improve care and outcomes for neurodivergent individuals across the life course. And as we'll talk about here today, there are very strong intersections between LEND and the AIRP, and they both enhance each other and each other's goals. And so we're excited to talk more about that today. Next slide. Some of the ways in which AIRP and LEND intersect are through these three entities, AUCD, the LEND Collaboration Committee, and the LEND Seminar Series. So the Association of University Centers on Disabilities is an extremely important technical assistance partner in the AIRP, and AUCD serves a key role in managing the overall functioning of the AIRP network. AUCD and their network of 143 university centers are members of the AIRP network and really instrumental in supporting dissemination and translation and other research and outreach and advocacy activities within the network. The LEND Collaboration Committee is a new entity within the AIRP because we really saw a strong intersection between the goals of the AIRP and LEND. So this committee includes members from academic institutions across the country that are involved in the National LEND Network. And finally, the AIRP LEND Seminar Series is an initiative associated with this LEND Collaboration Committee. And this seminar series seeks to unpack more some of the topics that are focal areas in our 6 AIRP research nodes. It's meant to address current gaps in research and streamline the research to practice pipeline within each node's research area. And we are excited that this seminar series is going to play a role in guiding LEND programs to incorporate new autism-related content into future curricula so that LEND trainees can gain relevant and significant knowledge related to improving the physical health and quality of life for autistic individuals. Next slide, please. Here's a great map. This is AUCD's national network of university-based interdisciplinary programs consisting of 68 UFIDs, 60 LENDs, 16 IDDRCs, and 12 DBP programs. And I hope that is the most acronyms I will say on one slide. Next slide. Another new initiative that we have that really speaks to the intersection between the AIRP and LEND is ANSWER, and that stands for Autistic and Neurodivergent Scholars Working for Equity in Research. And I look forward to telling you more about ANSWER in the coming slides, in the coming presentation. I have the great honor of being a co-lead on ANSWER. ANSWER is a group of autistic scholars who work across the AIRP to ensure that all of the work is guided by those with lived experience. And as part of their work, we have ANSWER reps on our LEND committee. And we'll talk more about the LEND committee, but broadly it includes members from academic institutions across the country that are involved in the national LEND network. And the committee's work aims to utilize the interdisciplinary expertise of its members to advance the knowledge and skills of healthcare professionals and researchers towards improving healthcare outcomes for autistic individuals. And so having autistic reps working on this committee, being a part of the interdisciplinary collaborations is a really key, important component of this work. Next slide. Okay, so now I'd like to have each of the panelists introduce themselves, and maybe when you are done introducing yourself, if you'd like to kick it off to the next panelist, that would be wonderful. So I will start with Sandra Friedman.
Okay. It's a pleasure to be here, and I appreciate being asked to be on that panel. So I have kind of LEND in my blood because I was a LEND trainee when I was a fellow, and then when I was at Boston Children's, and I moved on to be faculty. And as faculty, I also was a faculty for LEND too, and so I continued on LEND, and then I was recruited to come to Colorado, actually to reestablish a section and become section head. And when I first came, I also was associate director of JFK Partners, which has a LEND and USED. And so when I came, when I was asked to kind of develop clinical aspects of the program, research training, community engagement, which was within the section, but also was related to the LEND program. When I initially came, we had 129, we had 14 staff and faculty, and now we have 129. So it's grown significantly. And we saw children primarily less than 6 years of age. And now we see individuals from very young into adulthood. So we have interdisciplinary training programs, single disciplinary interdisciplinary assessments, single disciplinary assessments, and interventions throughout the age gamut. And so I ended up becoming director of JFK Partners, for which I'm very grateful, in 2015. And at that time, JFK Partners was integrated within the section of developmental pediatrics. It used to be it was associated with both pediatrics and psychiatry before, and then it moved into my section. And since that time, we really have grown different aspects of our training program. I mean, this coming year, we'll have 21 LEN trainees from 14 different disciplines, and we've expanded the number of disciplines we've had. We have expanded our research infrastructure for LEND as well as for the section, and also community outreach and training and dissemination. We've actually added more staff to the dissemination aspects of JFK Partners. So we have really continued to grow and try to integrate JFK Partners within the section of developmental pediatrics, but have JFK Partners keep its own autonomy. And I think we've done a fairly good job with that. Over the past 5 years, I actually been very proud about a program that we've developed that has outreach to rural, frontier, and urban primary care providers to have them identify, diagnose, and manage children with autism, because we can't see every child with autism, and we're the only tertiary care center within the state, and we serve a 7-state region. And we actually have had a LEN trainee who also was a DBP, Developmental Behavioral Pediatric Fellow, worked in that program, and that was part of her scholarly project. So, because all of our DBP fellows spend time in our LEN program too, which has enriched our program as well. And this year we also have family medicine and dental and other disciplines as part of our program. So, so I'm proud of what we've built up, and we could always continue to grow. And I think the AIRP connection has been wonderful for us, because we've taken advantage of, and we'll talk about it more, but the funding source and the webinars, and I'm on the LEN committee with both Tony and Jessica, and that's been a great opportunity as well. And I guess I'll stop talking and I'll pass it on to Tony.
Thank you, Sandy. Hello, all. I have also been with LEND a good long time. I'm Tony Whitaker, University of Tennessee Health Science Center in Memphis. I'm a developmental pediatrician. I began with LEND also as a fellow back in the day, I guess we'll say, quote unquote, and have been a faculty member for a number of years, and then the LEND director most recently about 7 years ago. So it's also been my pleasure to take there's so many right ways that LEND programs do things. I think it is interesting when we all sort of explore differently. I have been so grateful to have had a really good base in the program that already existed in Tennessee, but I have explored some new avenues, and I will talk about that a little bit when we get to some of the things we've done to leverage the program going forward. I do think the sorts of connections that we've had with the ARP has actually helped do a few different and new things. Still doing a lot of things we've done for years, but also nice to explore some new areas. So I look forward to talking with my colleagues about that. Thank you. And I guess next to Jessica.
Thanks, Tony. Hi, everybody. I'm really happy to be here. I'm Jessica Simisak. I'm here in Minnesota. I direct our tele-outreach center, which is in the research side of kind of the Institute on Community Integration here at the University of Minnesota, which is also our UCED here at the U. I'm also the research director for our LEND, and in a similar journey, I started as a LEND fellow when I was in my educational psychology program. And then went on to do some mentoring through LEND, and then came on as faculty, and then recently as research director, which was really exciting. So it's an important program to me. A lot of my research focuses on use of telehealth and other technology to overcome barriers to care access. And I'll talk a little bit about how we've kind of leveraged some of that research and opportunities for our LEND fellows within our LEND. And then most importantly, I'm a parent of a child with autism, and that's a very important part of the hats that I wear in life as well. Just a little bit about our LEND here at the U of M, of course, operates within our USED and our Institute on Community Integration. We were launched in 2008 with really that goal of improving the health and well-being of children, adolescents, young adults, and now across the lifespan, a few who have or have elevated likelihood of neurodevelopmental disabilities. We're interdisciplinary, as of course, with 14 and growing disciplines for future leaders to get interdisciplinary mentorship through. A lot of our work really focuses on, of course, that preparing of professionals and community trainees in comprehensive health, education, advocacy, clinical and translational research skills, as well as really a strong focus on comprehensive interdisciplinary training with that kind of upstream focus on preparing, leaders, future leaders, particularly in culturally responsive and evidence-based assessment, evaluation, intervention, and policy. And to date, we've trained 24,791 short-term trainees. We've started to bring on medium-term trainees and then 265 long-term trainees. So we're very proud of our LEND and ways that we can intersect with other LENDs and with the ARP network. Thanks so much.
Thank you so much to our wonderful panelists. Oh, Emily, did you get to introduce? You did. And
I will briefly introduce myself as well. I mentioned that I am a project scientist on the AARP. I'm also an assistant professor and developmental psychology researcher at UCLA. I am also the non-autistic co-director of ANSWER. And also the research director of our UC LEND program, where I supervise and mentor graduate student capstone projects. And like Jessica, I also started this work from a place of lived experience as a sister of an autistic individual who continues to inspire all of my work today. And I really try to utilize methodologies that are driven by the individuals, communities, and populations that my research seeks to serve. And that is kind of a big intersection for me when it comes to the ARP and LEND. Thanks.
thank you so much to our wonderful panelists for making your introductions. Can you all hear me? That's okay. My name is Charlene. I'm the operations director of AARP. Dr. Cole really wanted to be here, but she's actually at a sickle cell retreat and she cannot access her internet right now. And so I will be helping moderate this panel. So just to refresh all of our panelists' knowledge and also for all of our participants, each panelist will be allotted 2 minutes to answer the questions that will come up on the screen. If you look at Ben's slide, he also will have the timer up so you know how much time you have left, and then we'll do a quick Q&A and then we'll be off to closing remarks and close the webinar. So next slide, I will read off the question. So how has each panelist leveraged AARP to further LEND's mission? And I think we'll go in the order that we introduced ourselves. So Dr. Friedman. Oh,
Sorry. So to begin with, the AARP Scholars Program has been wonderful. We've had some of our faculty get funding for it. One of our faculty, Lindsay DeVry, had a Birds and a Bee program about sexuality, and she got funds for a pilot program. And I think that was the first funding she ever got. And after that, she went on to get an OAR grant. And she actually was recently invited to submit a full proposal to Department of Defense for career development grants. So the AARP Scholar Grant really helped her a lot. And then we actually have another faculty who got that grant, and she runs an adult neurodevelopmental disability program. She sees patients at the Children's Hospital and at the University Hospital. And so she really evaluated her adult clinic with the funds, and then she went on and submitted a K award about adults with autism. Unfortunately, it wasn't funded, although she's submitting again, but just the past week or two, she got a HRSA award for a demonstration project providing support for transition to agencies across the state, to include employment aspects of transition. We have a transition clinic, and we're lucky in our USED to have the Colorado Office of Employment First. So in addition to medical transition, we also talk about going, community, housing, transportation, shared supported decision-making. But now we also have a voc rehab person in our clinic. So that's been good too. And then the LEND committee and several of our faculty are also on different AIRP committees. And
Thank you, Dr. Freeman.
Okay.
Thank you so much. And Dr. Whitaker.
I love the music. Let's see if I can do. Thank you for the opportunity. Our LEND program has had the wonderful opportunity, I introduced a little bit of this, to be both at a USED, which we've been for years, but in the recent years, we've had the opportunity to expand into the hospital setting, our university hospital affiliation and relationship. And our LEND program is placing our trainees, and we have more connections to medical specialties and others within that setting. AIRP has been one of the points of connection where I can reach out to other divisions and specialties and make connections to include not only content specifically about autistic individuals, research on autism, but connection to our broader division and our broader mission to train for LEND, long-term trainees and others, short-term and medium-term also in this setting. So some of the specific types of projects we've thought together about, some of them we've applied for scholars funding, some of them we've begun discussions. The fact that it's a national network, that we have resources and people we can talk to locally and beyond, is a bit of a draw to bring in people that may not realize we do some of this kind of work in developmental pediatrics. So it's been a nice opportunity to have those conversations where we hadn't before. To the LEND students, trainees specifically, I'll say that we'll talk a little bit more about the video series in a little bit, but we've used those specifically with our LEND trainees, and that's been a nice opportunity to explore some of the specific topics of the nodes in ways that some we had done a little bit like that before, but others, it's a new way to think about things. So we've appreciated those resources available, and we will cover that in just a little bit. And I am just ahead of the music, so I will back to the next.
And Dr. Simasek, I'm sorry, is that how you say your name, Dr. Simasek?
Yeah, perfect. Okay. Yeah, I'll try to highlight some additional things. We also have really engaged with the kind of the scholars as kind of seed grant opportunities for early career, researchers who've been able to kind of pair up with some of maybe our fellows or fellow alumni. So that's been just a great program that we've been leveraging through the AARP. And then also just connecting fellows with the resources that come out, knowing what groups have different things going on. So kind of it being kind of a nice like clearinghouse where we can, loop back if there's an interest. Someone had a recent interest in sleep. And so we were able to kind of come back and talk about that with ARP and things like that. And then again, like kind of the networking and the connection opportunities, the more we know about the different focus areas of the different LENDs, and the nodes within ARP, the easier it is to kind of connect our fellows with those resources. Something I was going to bring up later, but would mention now is, fellows who really have that strong research interest in our LEND, we're kind of up against the clock, a little bit in that trying to get research opportunities within that year. And so the fact that ARP has some of these things like groundwork for them already laid is really helpful, because then it can kind of help us get people right, off to the rough and running right off the bat. Yeah, that's all I got.
And for my time today, I'd love to tell you a little bit more about how we are working with ANSWER, Autistic and Neurodivergent Scholars, working for equity in research, particularly around one of LEN's primary goals, which is training, publishing, and supporting the next generation of interdisciplinary and neurodiversity-oriented scholars. So ANSWER is comprised of 10 autistic faculty and postdoctoral scholars who are ANSWER leaders, and then 8 autistic doctoral students and trainees who are ANSWER reps. And they are supporting network activities around 3 central areas: leadership, ARP node and committee representation, and scholars. So with respect to ANSWER leadership, ANSWER leadership really focuses on mentorship and training, as well as building bridges between non-autistic and autistic scholars. A central component of ANSWER communication work is around publishing trainees and early career investigators in the AIRP Curious channel, which is a peer-reviewed journal run by the AIRP with leadership from ANSWER Communications Director, Dr. Patrick Dwyer. And our goal at UCLA is to have all of our LEN trainees publish their capstone projects in our Curious channel. I spoke a little bit about ANSWER node and committee representation with ANSWER reps sitting on our LEN collaboration committee, which is going to be really valuable. And then finally, we have a newly launched ANSWER Scholars program, which is particularly aligned with LEN's mission to promote the next generation of neurodiversity-oriented scholars. And ANSWER Scholars provides up to $50,000 annually in $5,000 and $10,000 awards that are given to autistic doctoral students or healthcare professionals to perform mentored projects. So that is a little bit about how ANSWER is furthering LEN's mission.
Thank you, Dr. Hotez. I will read out the next question, but before I do, we'll have a short Q&A, so thank you, Robin, for your question. We'll be engaging in that at the end of our panel discussion, and so I'll read this one out loud. Can you each tell us about successful research projects your LEN trainees have worked on? And this question is directed to Dr. Simasek and Dr. Hotez.
Start if you want me to. I'll keep it brief. There are 2 successful projects we wanted to highlight that ended up being successful for actually multiple fellows, which was a really great model. So one was that kind of focused multi-year project that as LEN faculty, we put together an area where we have, some active research going on, kind of broadly focused on methods to understand and overcome barriers to care access for children with neurodevelopmental disabilities and their families. And so this was a project that fellows could sign up for, and they could kind of do one of 2 things. They could get engaged in an ongoing project and play a important role in that project. Or they could kind of carve out, an area that was related to that overall theme, but, more unique to their specific interest. And so examples of things we've done under this project are surveys of providers or families, focus groups for, specific populations around experiences they're having on wait lists or things of that nature. And since we've had, multi fellows kind of do this project over years, we also have kind of exemplars of how others have kind of leveraged this topic area and been able to expand it or make it their own. And so examples of folks who've come on over the past, I think like about 4 or 5 years that we've had some iteration of this project up and running. We had a fellow who's a physical therapy student and was able to kind of take methodology we'd use with other types of providers to connect with providers who are supporting children with neurodevelopmental disabilities as they were kind of transitioning from pediatric physical therapy care to adult physical therapy care. And so with that kind of ready-made, methods, she was able to adapt that to her needs and carry out the kind of the IRB through the survey, through kind of aggregation of those results at the end, which was great. We've had fellows who've kind of gotten started supporting a project and then gotten really interested in that area and chosen to come back and continue to kind of participate as a capstone. So we had a couple doctoral occupational therapy students who did that. So they were able to kind of build off of what they had done in their LEND in the future. And we also have had postdocs who've applied for things like ARP or OER grants to be able to kind of, again, do that kind of continuation of maybe a line of research that they start during their LEND into the future. One other area I just wanted to highlight quick is at ICI, we have a policy research brief project where fellows can come on board. They can use data that we already, have access to or collect new data to kind of produce a policy brief, of course, with mentorship from a team, and then a forum to present that brief, to a group that might include, people with disabilities, their families, policymakers, self-advocates, et cetera, researchers, so they can kind of leave with like this product, and then also that experience of presenting, some translation of that research to kind of a policy forum format, which is great. And I would just note, I know my time's up, through this, we've had people be able to go on to really successful careers in research. We have fellows who've gone into the NIH to work, who've gone into the university here at our center and other departments at the university and in community research organizations. So it's been really great.
It's been great to hear about the kind of evolution of the projects that you spoke about, Jessica. It sounds similar to our process here at UC Lend. As the research director, it's been kind of trial and error to achieve the correct scope for Lend capstone projects. We've tried to make them ambitious enough to advance the trainees' knowledge and skills, and also in alignment with their goals, but also feasible enough to complete with limited time and resources. Initially, this process involved, me submitting an IRB on the trainees' behalf, which would often cause lots of delays. But this process for us has really evolved. And now we have a system where we create a menu of flexible capstone options with proposed learning objectives and skill development at the beginning of each training cycle. And then trainees are assigned to a project mentor based on the project, and then they collaborate with the mentor to devise an applied project that's realistic and really aligned with their goals. So most recently, we had a few really successful projects. One kind of bucket of projects involves the development and pilot testing of data collection materials. So not necessarily conducting a full study where they are testing a primary research question, but they're really laying the groundwork for a research study by developing data collection materials. And then obviously they have the option to stay on after the 1-year research capstone if I haven't totally annoyed them and they are still okay to work with us. But within that bucket, we've had development and pilot testing of an interview guide for older neurodivergent LEND patients. We've had development and testing of a focus group protocol for medical students on disability education. We've had development and testing of an interview guide for healthcare providers on supporting gender and neurodivergent patients. And we're excited to kind of see the evolution of these projects and maybe have future trainees use these data collection materials in their research. I've also seen success with trainees developing kind of scoping review protocols or systematic review protocols that might require extensive literature reviews, because you typically do not need grant funding for those types of projects, and the IRB can be relatively straightforward. So most recently, we had a trainee working on a scoping review on telehealth medical home models. And then finally, a lot of trainees are interested in QI projects that support LEND's mission. So most recently, we had some trainees working on the development of a revised gender screening protocol for LEND patients to be more aligned with gender diversity. And I'm looking forward to seeing kind of the next cohort of trainees picking up that project and continuing.
Wonderful. Thank you all. And the next question is directed for Dr. Friedman, Drs. Friedman, Whitaker, and Simasek. What are the challenges you encounter when instituting collaborative research?
Well, one of the things that AIRP requests the CREs to do is share data on the ICR database. And I have been having a hard time having people put their data in the database. I think they've been kind of concerned that they're not ready to share the data, even though we've talked about nobody's going to share it without your permission, but they've been reluctant to upload it into ICR database. And I think we need somebody from maybe ICR to talk to our faculty more. We talked about it at the recent LEND committee. But as much as I try to get people to upload their data, that's been a hard thing to do. Now, there's collaborative research within our LEND. We have LEND trainees use databases from our individual faculties research and published on it and written chapters on it. And we've had past fellows and faculty collaborate on research projects that are ongoing. And so we collaborate within our group, but I think we need more collaboration within the AIRP group. And I forward all the webinars, notices, and all the funding opportunities to all the faculty and trainees. And I don't think people take as much advantage of it as they should or could. And that's something that I need to keep working on, but we talk about it at faculty meetings, at fellows meetings. But it's been a challenge to have everybody engaged as much as it would be, as it would be preferable. But we are trying, and we're doing little baby steps, but everybody collaborates within our group, but I think we need more collaboration for research within the CREs and AIRP. And that's for research. We do educational things better. And that's it.
Thank you. My picture's up on my, I think it's my turn. I have, let me start with a positive on the network again. It's been such a great opportunity to be part of the discussions of building the network and building the specific resources that we have used as a group, both for the CREs to start, but then with the intent to be able to share more broadly. And that has been nice to be a part of that. And it helps to feel like we have voices in how that goes. But it's also been some challenge that everything wasn't, just like a present unwrapped for us, but we've got to build it first. So I think the timing as to when to involve people, when we talk to our partners or even those within our team to say, this is coming, we're working on it. I think it's been a little bit of a challenge to help people gauge when it will be the right time for people to jump in with their piece. It's nice to be able to talk it up and be able to say, we've got these pieces coming or these pieces are already here. Let's start working on those. But I think timing, as with many things, it's something we have to work to balance that as we go. It is also a challenge for us as we have done so collaborative research also within our division and our center and our LEND programs, done that in a certain way. It is a wonderful opportunity to be able to think about doing that a little bit differently and to add the partners. And that is a particular strength looking forward. But with the way the network does things, we have to just be aware of how to present and help get procedures and processes and sort of the ways we think about doing that research. We have to connect those. So I do think that's the job of us who are in the CREs, pulling things together, the LEND directors and others who pull those pieces together for our team so that everybody sees how it can work together. But as we build the pieces and show everybody how it works together, that will still be a continued, it has been a work in progress, but I think we'll continue to work on that some from here. And I yield my 17 seconds.
Thank you. Yeah, I would agree. Just a few additional things, as I mentioned it earlier, but we do collaborative research, within our LEND and try to kind of work across departments and colleges here in the university. The timing, I think, again, is the thing that we're always kind of trying to think creatively about. As Dr. Hotez, mentioned that trying to get a IRB through and then half the LEND year is done, so trying to work ahead on some of those things so the best we can is something that we've found to be successful and we keep trying to build towards. Something new that we're trying is trying to identify fellows with really strong research interest, right off the bat as they're applying, so that we can kind of get them started on that, more research focused trajectory right away when they start. We're calling it our kind of research intensive focus. That another way we kind of try to work around that timing is that building off of previous research or having these kind of multi-year projects where others can kind of pick up where someone else has left off or take it in a new direction. I like to hear about some of the journals that you're using to publish some of these findings. We have thought about, we've done some policy briefs and people have published, papers and presented, but trying to do things like put in for national conferences early on, knowing that some of those things are going to be due as, before the LEND year even really fully starts, so that we have some slots set aside for those times. And then I think about as we try to do that more collaboratively, maybe across LENS or with the AIRP, just the sooner we can start on it in advance. It's like we almost need, 6 months ahead of time to be preparing for the next year if we're going to be doing activities like that, just to get things ready. I think another area we haven't leveraged as much, but would like to, is here at our center. We do have an advisory council of self-advocates, and we really center on, lived experience as well. But making more of the answer committee and ways that we could get engaged when we have projects that might not be large, funded projects, but might be LEND projects. So I think that's an area we'd also hope to engage a little more than we have historically.
Thank you so much. And the next question is, would you mind discussing any ongoing work within ARP LEND Committee, Drs. Whitaker and Dr. Friedman?
Yes, and I don't recall, Sandy, jump in too if you want, but I don't recall if we have put the link to the videos here or if that's appropriate. We have spent quite a bit of time working on the LEND Collaboration Committee on a series of videos that are intended to encapsulate the nodes of the AIRP network, the focus areas that we want to emphasize for LEND trainees. So the LEND committee has worked on making these videos with the LEND trainees specifically in mind, though they may be appropriate for others as well. These videos on the various nodes focus in the network have lived experience included, autistic individuals, fully in on the conversations. There are more conversations around topics. Some will be conversation only. Some will have a topic first for background and then have a conversation so that LEND trainees can get a variety of perspectives. And we have a series of prompts and discussion points that we intend for these videos to get used hopefully by LEND programs to have discussions within your own LEND training groups. We're rolling some out for the fall, but I won't take all the glory and get to tell that. Sandy, would you mind telling a little bit more about that? I don't want to.
I will, but I just want to. I just realized I don't know if everybody on this call knows the nodes. There are 5 research nodes. I don't know if I can remember them. There's primary care and systems of primary care, there's neurology, there's genetics, there's health systems and services, and there's sexuality, gender, and reproductive health.
And shouldn't you just put a link in the chat?
Oh, yeah. So we were assigned different the people on our committee were assigned to record with the head of that research node these educational modules. And that's what Tony was referring to. And we've already, and we haven't used them in our LEN classes. We actually have educational modules from HRSA from our PAC West that we've used, but we're hoping to integrate those the modules from AIRP more. The other thing I think that Tony was alluding to is that this coming year, we are going to have a different LEND or CRE is responsible for taking one of those modules and presenting it not only to our LEND, but any LEND across the country. There's 15 CREs who are part of AIRP, but this is open to anyone who wants, and we will be doing it. So our group will be doing sexuality, gender, and reproductive rights in January, and we're each assigned another another module, another part of the year. And the hope is to get not only our trainees, our LEN trainees, but LEN trainees across the country to participate. And it's hard with different time zones, but there should be some flexibility in some of these presentations. And so that is, so Kasia Rosenall is the head of our LEN committee, and she's the one who has been ushering us through this. And so this will begin in the fall, So we will have modules, we will be teaching, we hope we'll be presenting to all the different LEN programs if possible. Did I get it right, Tony? Okay, so those are really the two main things.
Yes.
Yes,
and
flip, right. It's a flipped classroom, right? Thank you. Is in October. Thank you.
Thank you so much. And so our next question is, how do the participants on this call get engaged? And so I'd like to turn it over to Dr. Hotez.
Yes, I am posting in the chat lots of different ways you can engage. I encourage you to take a look at the ARP website. You can also reach out to the ARP and we can direct your inquiry to whoever it should reach. You can also reach out to me with any answer related questions. If you're interested in having your LEN trainees publish in Curious, Curious is a peer-reviewed journal platform, and ARP has its own Curious channel where we specifically publish on autism and physical health related issues. And we at UC Lend are encouraging all of our trainees to submit to Curious if they'd like to get published. It's a great mechanism to publish kind of pilot, preliminary, exploratory work where maybe it's not quite ready for a traditional peer review publication, but there is utility in publishing it as a first step in a line of research. Curious is a great option. We have answer folks who are leading the editorial process for Curious. So all of our articles are going to be reviewed by autistic reviewers. So we are kind of creating our own thing in our Curious channel, and I encourage you to reach out if you're interested. And then there is the UC Lend email if you'd like to contact them as well.
Thank you. And so now I would like to open it up for a few minutes. I think we have a truncated kind of question and answer section. Robin had initially put something in the chat. I know she had to jump off a little bit early, but I'll read the question aloud. It is general to, so I'll read it. What is a bit unclear is how the 46 LEND programs that are not at one of the 14 ARP sites can or cannot get involved in ARP research and resources. And so I'd like to throw that over to the panelists, and then I can add to if you'd like.
I'm happy to jump in just generally. If you are in a LEND site that's not part of the ARP right now, please just reach out and we can figure out a way to collaborate, devise a mutually beneficial collaboration. So please reach out if you are interested in doing something. I'm not sure if maybe there are particular opportunities in the LEND committee where that might be an option, but you can definitely reach out to the general ARP contact.
And
There are also
and-
wonderful, oh, sorry,
go ahead,
Tony.
Sandy. No, you go ahead.
There are wonderful resources on the AIRP. There's resources for researchers that are, you just have to go on the website and you could access them. And if you go on the AIRP website, there's things that I think anybody could access, you know, LEND programs, DBP programs. They have great resources. So I'm giving a plug to the website.
Thank
And
you, Dr.
the videos we mentioned, those really were intended to be for all LEND programs. And while they're conversations, they are research based. So they relate not only to the topics, but have research content and really should be pretty good for conversations around the topics in any LEND program. We'll have the series starting this fall, but they are, you can use them yourself. We have the resources available for any LEND program to use.
I think any DBP program too, because they're HRSA funded. So it's really just not LEND.
Absolutely. Thank you so much. I'd like to pass it to the audience if there are any questions for the panelists. I actually have one question for Dr. Hotez in terms of getting more involved with Answer. Is there any possibility that we can offer involvement with Answer?
Yes, again, please reach out. We're in the very early stages of developing all of our processes. So we're very open and flexible with respect to possible collaborations or things we might do. So reach out. We recently just selected our first round of Answer scholars. And hopefully we will be able to offer this program again. So if you do have autistic doctoral students, or if you are an autistic healthcare professional with maybe primarily clinical work and not research work, the Answer Scholars could be a good grant mechanism to get you funded. So reach out.
Thank you. I'd like to, are there any, pass it to the panelists for any last words in closing?
Thank you for joining us today. And thank you to AIRP for this opportunity.
Certainly, we'd like to thank all of the panelists and all of the participants for joining. We hope you learned a little bit more about ARP and LEND and the cross collaboration. And Ben, is there something that you'd like to say?
Yeah, thank you all. Just before we go, a reminder that the webinar has been recorded. It'll be archived on the ARP website and on the YouTube channel. And then also I'm going to post in the chat link to a post-webinar survey. We would really love if you could complete that, take maybe 2 minutes of your time. That helps us in creating future webinars, your feedback. And then finally, the next webinar will take place on August 20th at 4 p.m. Eastern time, 1 p.m. Pacific time. So I really hope to see you there. Once again, thank you for coming.